I'm Peter Block here in Chicago at ACC.16 for On the Scene, and with me is Anand Ganesan. He has been dealing with a cardiovascular problem that really goes across the entire globe, doesn't it? And this has to do with not cardiovascular disease, but cardiovascular health. So Anand, tell me about your study, because it's an important one and possibly going forward a critical one.
Thank you. We studied Stepathlon, which is a 100-day international worksite-based predominant program that uses mobile health or mHealth technology to be delivered. Stepathlon is a program that is now conducted in around 64 countries, and in our study we evaluated outcomes in 69,000 participants.
Wow, a lot of patients. And what did you do? How'd you get them to do extra work?
So the way the program works is that it's an employer-based event with teams of 5 who are encouraged to, in a social and competitive way, to increase their step counts and physical activity. They are sent daily messages via a mobile device, app and website, and encouraged to log their physical activity and steps on this website. In our study, we evaluated the outcomes of the program at 100 days in terms of physical activity measured by step counts, sitting duration, and weight.
And I guess I have to ask you now what you find.
Yeah, so our principal findings are that after completing the 100-day program, participants overall increased their step count by 3,519 steps per day. They reduced their sitting duration by 45 minutes per day. They reduced their weight by around minus 1.5 kilograms per day, or lost about 3 pounds on average per participant, and they increased their exercise days by around 1 day per participant per week.
Okay, so tell me something. What does this mean going forward? I mean, should the entire world pick up this kind of activity? What do you think ideally we can do with this?
Absolutely. So primordial cardiovascular disease prevention is a crucial problem for the cardiovascular community as a whole. We're facing a crisis of increasing body mass index around the world. We need large-scale mass participation programs that can reach people at cardiovascular disease risk around the world, wherever they are. And these programs have to have the capacity to reach people who we can't see in clinic or who can't be seen by a health professional. So programs like these that use mobile health technology allow geographically distributed implementation in socioculturally diverse and socioeconomically diverse settings. I think that's the real lesson of this data, and that's the real lesson of our program.
Okay, so a first look into how we might improve cardiovascular health around the globe. And certainly my only advice, I guess, would be, and his as well, would be get a pedometer.
Keep walking.